I'm Dr. Milena Horvat, Associate Dean Graduate Studies at the Faculty of Engineering and Architectural Science. Welcome to Operation Breakthrough, Innovation from FEAS, a new initiative from the Office of Social Innovation held in partnership with the Faculty of Engineering and Architectural Science. In this series, we bring together students, researchers, and educators from Ryerson University to share their work and innovations that they have done in response to COVID-19 and the social changes since they occurred. Good morning. We are meeting with Sinthuran Jegatheeswaran today, and he's going to talk about his project. So, Sinthuran, can you please introduce yourself? Which program or department, or what's your position? What's your area of study?
I'm in chemical engineering program. I'm doing my PhD. I just defended my thesis a few months ago, and I'm pursuing my postdoctoral fellow at the chemical department at Ryerson right now. Yeah.
Can you, just before we started this interview, you were telling me how did you come up with the idea to do this? Because this is a little bit outside of your thesis work. So can you tell me? That's a very interesting story.
Okay, so last year, I was in 2019, I attended the Biomedical Nights, biomedical conference co-hosted by the St. Michael, a collaborative effort between St. Michael Hospital and Ryerson University. It was hosted by the students, for the students, and for the students. And in that conference, there was a lot of presentations going on about biomedical projects, and then somebody talked about modeling of there were different projects, and then when I reached out to Dr. Ryerson, he was the vice president of research and innovation at the St. Michael Hospital. And I sent an email to him saying that, I'm very interested about the project that you have that was hosted at the conference. And I wanted to, and then you mentioned about the interdisciplinary collaboration, the emphasis on the interdisciplinary collaboration between the St. Michael Hospital and Ryerson University and UFT professors. So I thought, I'm a chemical engineer and they are doctors. And what if we can collaborate and then we can come up with a great idea? Then I reached out to him, and then he referred me to Dr. Zhang, Dr. Hybert Zhang, and I had a meeting with him. He called me for a meeting the next few days after, and I met with him. I presented my research findings to him, like I presented my research, and then he liked the idea, and then he asked me, well, this looks like a fluid dynamics project, so why can't you just do can you do anything with the airflow inside the lungs, that sort of idea. He asked me that question. And then I asked him, well, that's possible, but we have to look at it. And then he posed these questions to me. There was a challenge in that he faced, that in lungs, in breathing, affected lungs doesn't have the capacity to exhale carbon dioxide out of the lungs, because already it's affected, and the diaphragm muscles does not contract and stretches effectively. It loses the ability to exchange gases back and forth. So what happens is we have oxygen coming through the trachea into the bloodstream, and then carbon dioxide from the blood goes from the bloodstream and then removed through the trachea to the outside of the body. So this is influenced by pressure gradient and velocity gradient mechanisms. So they are not, as a lungs doctor, they know very well about how to treat the patients and everything, but they may not very know about the fluid dynamics concepts very well, because I'm a fluid dynamics expert. I know about fluid dynamics and CFD simulations. And so I told them, well, there is a possibility that, okay, we can simulate this and we can understand that, and then we can help simulate and get some insights from these from the CFD insights. Then we can understand how does the carbon dioxide goes from the bloodstream into the air, and how does it been exhaled? So
that's very interesting story, because it shows that sometimes innovations or idea for innovative ideas come by accident. Like you didn't expect it. Something that you saw inspired you, and then you reached out and made a team and did something very new. That's very interesting. I think also could be useful to our other research students to be open to really thinking about sometimes unexpected collaboration. So do you see this going in any way beyond the COVID-19 pandemics? This knowledge and this innovative knowledge that you created?
Go through mental stress, anxiety problems, all these issues and so on. So I think post-pandemic, we're gonna. I think there are already statistics showing that people are going to go through depression issues, mental health issues, and so on. So what I'm trying to link is I'm trying to link yoga to this. Mm-hmm. What I'm trying for, because I reached out to Isha Foundation, which teaches yogic practices to people, and then I know meditation myself. I've learned from yoga, and then I personally know what is the influence of what is the effect of breathing exercise on the overall health, physical health, mental, emotional health, and well-being, and so on. So I have another idea that I wanted to simulate the breathing exercise process, mm-hmm. CFT, the airflow structure, the air resistance, because we have a rapid breathing, alternative nostrils breathing. So what we do is we change the boundary condition on the CFT and simulate the process. And if there any way that we can throw in, and that would shed light on how the breathing exercise, the patterns inside the lungs could help change the way you are. Mm-hmm. So at the same time, yogic methods is also a good way to help restore the viscoelastic the behavior of the lungs tissue. So if you practice yoga for a long period of time, possibly these patients who recovered from COVID-19 or the patients who are under ventilator support will gradually recover from these respiratory problems over a long period of time. That's my hope, and that's what I want to prove to scientific evidence and to rigorous data and that sort of thing. And that's my long-term plan, but I'm not sure how far I will achieve, but I will, at least I will pave a way for that.
Thank you. I'm sure that you will achieve, because I've seen you, I know you as a graduate student for several years now, and I witnessed how you reach out and reach your goals and actually achieve your goals. So I'm sure that this will happen one day. Thank you so much, Sinthuran. This was very exciting and eye-opening, actually. I thank you for this explanation, and I definitely congratulate you on this project, but also on completion of your PhD. Thank you for joining us. To learn more about the Operation Breakthrough or to submit your own innovative project in response to COVID-19, please go to ryerson.ca/social-innovation/operation-breakthrough. Goodbye for now, and I look forward to seeing you in our next interview.